so much for that introduction. I've put together a couple of slides to give you an overview of our implementation science framework that can be deployed towards introducing, implementing, and scaling up antenatal MMS. Let me take you through those slides. So what is implementation science? Implementation science is a systematic approach to understanding problems related to program implementation, then identifying and testing possible solutions in an adaptive or iterative process to ensure effective and quality implementation of health interventions, strategies, and policies. Unlike clinical research, which measures health outcomes such as birth weight, implementation research examines implementation outcomes such as feasibility, coverage, cost effectiveness, equity, etc. The key question that gets answered is how much and how well the strategies optimize the intervention to improve MMS uptake and adherence. When looking at implementation science in the context of MMS, the overall objectives are: 1, to inform the implementation and effective scale-up of MMS; 2, to gain operational experience around MMS delivery in the context of ANC services; and 3, to strengthen health systems that support MMS delivery. As you can see from the slide, implementation science approach includes 3 phases, which look linear on the slide, but in fact are often both iterative and fluid, meaning that one often goes back and forth between the phases. Phase 1 includes building an enabling environment for MMS. For example, we often work with local partners to conduct landscape analysis, which are used to better understand the context and stakeholders in which the intervention might be adopted, as well as support awareness raising and consensus building activities that may lead to MMS policy and program recommendations. Next is the designing and testing of an implementation strategy. This often includes formative research to understand barriers and enablers to intervention delivery and uptake. And often it includes an evidence-based process for the co-designing and testing of implementation strategies by local stakeholders. Finally, the third phase is the scaling of the implementation strategy, which is intended to be informed and supported by phases 1 and 2. As you can see, stakeholder engagement cuts across all the 3 phases. It's important again to note that there are many other successful implementation research approaches used by UNICEF and others that follow a similar pathway. And they may look a little different compared to what I'm showing here. But here's what's most important. Successful implementation science depends on local and national leadership and partnership. Now, I will be talking about each of the 3 phases. Phase 1 focuses on fostering an enabling environment, starting with undertaking a landscape analysis. The objective of the landscape analysis is to identify barriers and opportunities for integrating MMS into the antenatal care platform using a participatory approach. Landscape analysis involves review of maternal nutrition situation, antenatal care platform, existing policies and programs, supply readiness assessment, and finally, identification and mapping of key stakeholders. Landscape analysis is followed by awareness raising and consensus building, 2 activities that are critical for informing and planning the next phase of activities. Phase 2 starts with formative research to understand the delivery of prenatal supplements at the national, provincial, district, facility, and community levels, and the barriers and enablers to coverage and adherence. Some of the data collection methods deployed during formative research are comprehensive desk review, quantitative surveys, and qualitative inquiries. Formative research is followed by designing of the implementation strategies. The purpose here is to validate and clarify questions and findings from landscape analysis and formative research and inform implementation strategies that are responsive to program and country needs. Key activities include presenting formative research findings to the broader group of the stakeholders and co-developing and prototyping implementation strategies. Following designing comes the testing of the chosen implementation strategies. The key question to be answered is, how can antenatal MMS be effectively implemented and scaled within the country's national health system context to support improved maternal nutrition. While the study design is governed by the implementation strategies and specific implementation questions coming out of landscape analysis and formative research, outcomes focus on process indicators and contextual influences. Phase 3 focuses on the dissemination of findings along with planning for a national scale-up. The goal here is to develop guidance for large-scale national deployment that supports commitment and action by local decision makers throughout the health system for building capacity of health system personnel, integrating MMS monitoring and evaluation into the health system's existing monitoring activities and national surveillance systems, and financing large-scale sustainable MMS implementation, including demand generation, product procurement, and service delivery needs, such as continuous training and support. This slide gives a quick snapshot of where different countries are in this process that Vitamin Angels is supporting. Let me walk you quickly through a case study on Vietnam. We recently completed a landscape analysis in Vietnam and organized a stakeholder workshop in collaboration with National Institute of Nutrition Vietnam, chaired by the Director of National Institute of Nutrition, with participants from the Ministry of Health, along with international and national nutrition experts. Over 140 participants attended the workshop that identified MMS as a high priority area for Vietnam and recommended setting up an action plan to implement MMS in Vietnam in a systematic way at the national and provincial levels. Some of the specific recommendations that came out from the landscape analysis and the stakeholder consultation workshop held in Vietnam included: 1, expanding the scope of Nutrition Steering Committee to provide political and technical support for MMS implementation. 2nd, to include UNIMAP MMS in the National Essential Medicine List and coverage of all pregnant women through national health insurance. 3rd, to build a committee of experts assigned to support the provinces to create contextually appropriate nutrition action plans, which include MMS. 4th, to conduct a pilot to introduce and scale MMS in selected provinces through the existing antenatal care platform. And finally, to investigate barriers and enablers for UNIMAP MMS production and supply in Vietnam. Thank you so much.